Hi, my name is Margarita and this is my mom Mika. She would like to share with you the story of my stomach migraine. This condition lasted for about 5 months. Compared to people who have suffered from a migraine for years, it looks like a very short time. But for me, for her, and for our entire family, it was the worst 5 months of our lives.
Hi, my daughter got sick in the summer of 2005, a day after our cat died while he was being neutered. He went to the clinic to see him. On the next evening, she started complaining from stomach pain, nausea, and later on she started vomiting. We took her to the emergency room. She went through many different tests, but the doctors were not able to find out what caused the pain. They gave her different medications, but the only thing that was able to stop the nausea and vomiting was a very strong narcotic medication that is given to patients after surgery. This made her sleep about 10 hours, and after that she felt better. On the next day, she was on a light liquid diet. One day after that, in the evening, she had another episode with the same symptoms, and we took her to the emergency room again. The doctors did more tests, and again the tests showed that everything was normal. The only thing that helped was the same strong medication, and after she slept for 10 hours, she was feeling well again, but there was another episode, a day after that, for the third time. This time she was hospitalized right after the emergency rooms. The doctors wanted to do an endoscopy and a CAT scan to see if there was a tumor in her brain. The results were normal. Everything showed that she was in a good physical health. There was no reason for her symptoms. She stayed at the hospital for 3 days, mostly on a liquid diet. Every time she had an episode, she was given the same medication. She was discharged and diagnosed. After a few days, everything started over and she was hospitalized again. The doctors wanted to do another test, but they could not because right before the test she had another episode. She stayed at the hospital for 3 days and they did not know how to treat her condition. Then I remembered about the accident with the cat, and I told them that she was very sad and she might have been scared to see him dead. Then a psychologist talked to her. He thought that she was depressed and he recommended antidepressants. We did not agree because of the bad side effects and because we found out that in some countries these type of medications are not prescribed to children, and she was 17 years old back then. Also, the doctors did not know if this was going to stop her episodes. She was still undiagnosed and they transferred her to a different hospital. The following week, psychologists, psychiatrists, and doctors who have knowledge about the different pain medications started working with her. They tried to find out why she was having these symptoms and what the best treatment was. They wanted to stop the strong medication that was given to her several times already because it was addictive. But this was the only medication that was giving her relief. So they were trying their best to find something else instead and were leaving her suffering for about 15 hours, during which they used different medications. Since nothing else worked, she started to get anxious and started making herself vomit because this was giving her relief from the pain and nausea for 20 to 30 minutes. This was the time when the doctors decided that she needs anti-anxiety medications. The medications made her sleepy, but they could not stop the episodes. The doctors also thought that she might be bulimic or anorexic. On the 7th day, they transferred her to a health unit for kids with behavioral problems and eating disorders. There she was given high dosage of the anti-anxiety medications that changed her a lot. She started forgetting. She could not remember what she had done a couple of hours ago. She had no emotions at all. She was not smiling. It looked like she was not suffering either, just as she was not there. She was absent. They discharged her after 15 days, and the doctor's recommendation was that she needs to take antidepressants. Margarita became unsure afraid that she was really sick and that we were hiding from her what the problem was. Toward the end of October, when her period started, she had cramps and she got scared that everything was going to repeat again. She became anxious and she had another episode, so she was hospitalized again. She stayed at the hospital about a week and she was given different medication, and this time we agreed that she had to start taking antidepressants. She started taking them in the beginning of November. Toward the end of November was the following episode, and again, emergency room, hospitalization, and more medications, but nothing actually worked. This made me believe that we could not count on this course of treatment anymore. It was time to research some other options to see if the alternative medicine had a treatment for her condition. We are from Bulgaria originally, so I contacted some Bulgarian doctors and they said that they could try to help, but she had to go there. I learned about Mr. Gotchev and his treatment through a friend of mine. She told me that he was a homeopath. I did not know what this exactly meant. All I knew was that it is a part of the alternative medicine, but I have never been interested in it. I called him and I explained my daughter's condition to him. He said that my daughter had symptoms of a stomach migraine and that he knew how to treat it. I could not believe it. So many doctors did their best and they could not help, but he understood her problem and he was sure that the treatment was there. I was thinking, no way, impossible. Meanwhile, Margarita was in the hospital. During this couple of weeks, she had episodes that lasted days. Nothing could stop them. She started complaining from chest pain. The stomach pain and nausea were unbearable. She was making herself vomit so she could feel better for at least a half an hour. The doctors recommended that her hands were tied so she could not do it. Then she started experimenting with hot showers. They helped her somehow. She would take more than 10 showers some days. One of the doctors said that she was doing all this to attract our attention. This made her feel really bad. She felt like she was in this serious condition and nobody was able to help her or even believe her. By this time, the doctors decided that she actually has an eating disorder, and they recommended that she gets a treatment in a specialized clinic for people with eating disorders. Since there is no such a clinic in our state, we found one in a different state and I took her there. The psychologist who admitted and interviewed her understood that she has nothing like an eating disorder, but he decided to admit her and monitor her to try to determine what the problem is. She stayed there for 10 days, had 2 episodes, and went to the ER twice. Because of that, and because she was medically unstable, she had to be transferred to a different hospital. They flew her with a medical emergency plane to a different city in the same state. Her blood picture was bad. Her vital signs, blood pressure and pulse changed drastically when she was getting up from the bed, so doctors wanted her to move around in a wheelchair because they were afraid that she might fall down. We were asked to give our permission so she could start a new medication, something that could help her if she had a stomach migraine. The medicine had bad side effects. It could have been fatal for the liver and pancreas, even if taken for a short period of time. And there was no guarantee that it was going to work for her. This lasted for a couple of days, and the doctors dropped the diagnosis. They said that once she gets medically stable, they would discharge her and she had to work with a team of doctors back in our state. This team had to review her medical history and come up with a treatment plan. We had been told that if she has stomach migraine, she'll have to learn to live with it. The treatment might help to make the symptoms milder and not so often, but she had to learn to cope with pain. They suggested that I might have to take care of her in the following 6 months. My daughter's last hospitalization was from end of November through January 1st in 3 different hospitals, 2 different states. She was discharged and diagnosed. She was not getting better. The prognosis for her future was discouraging, but this was my daughter, and I could not accept this future for her. I knew there was only one option left. The only person who claimed to be familiar with this condition and knew how to treat it was Mr. Gotchev. I only had to make sure that she was in the best possible health so I could take her to Bulgaria. Since I had to take care of her and I was absent from work so often, I lost my job. I had to take her to the doctor's office every other day for blood tests. Meanwhile, I bought tickets, and in the middle of January, we arrived in Bulgaria. Margarita's treatment started on the next day after our arrival. It included massages with essential oils, herbs, and homeopathic products. Between the 10th and the 14th day of the treatment, she gradually stopped taking all of the medications that she was given previously. She started to feel relieved, cheerful, and optimistic. She looked healthier, happier, felt better, and she understood that there was hope. The doctors who treated her during the first 5 months told us that I have to take care of her 6 to 12 months and that she will have episodes all her life if her condition was a stomach migraine. Well, she went through Mr. Gotchev's treatment that continued a couple of months, and she did not have a single episode. In the past 5.5 years since that, she had not had another episode. Thanks to Mr. Gotchev's treatment with the essential oils, herbal tea, and homeopathic medications, my family regained the happiness and joy in life.
Thank you, Mr. Gotchev, for everything you did for me and my family.